Okay. Can you hear me? Kate, is this on? Okay. The light is there. Okay. It is 4 o'clock, so welcome everybody to the regular monthly meeting of the Indian River County Hospital District for the month of March. So we are here, and I would ask Reverend West if you would come to the podium.
Do we not have a screen?
The screens aren't on.
Where?
All right, can we get that after the, where'd you do that?
I don't see it.
Two over from,
It's hidden somewhere.
yeah.
Okay.
There, you hit something. That thing, that blue thing.
I got it.
All right, can we please let Pastor West do his invocation?
Great God of heaven, we thank you so much for our community, and I thank you so much for our county. I thank you for the passion of everybody gathered together within the sound of my voice to care about people that are in need. And Lord Jesus, I pray that today that you would guide them and that you would be with them. As there's a presentation I understand about a mother's plea and fetal infant mortality, Lord, I pray that you would just give them strength, and you would give them strength and grace to make wise decisions. For it's in the name of Christ I pray. Amen.
Amen.
Thank you.
Thank
Thank
you,
you.
thank you. Michael,
Yes.
lead us on the pledge.
What are we pushing here?
I pledge allegiance
To the flag
of the United States of America,
to the republic for which it stands, one nation, under God, indivisible, with liberty and justice for all.
Thank you, Michael.
I have a major problem.
And may I hear a motion on the consent agenda for the approval of the chairman's meeting minutes dated February 17th, the regular monthly meeting minutes dated February 18th, and a March disbursement of, Mr. Jones?
$1,088,029.99.
I hear a motion.
So move.
move.
Second, okay, approved? All
Aye.
in favor? Aye, thank you. I am going to limit my report today. I am very happy to report that Carrie Bartlett has, the governor has asked her to step in as the trustee in place of Tracy, and she has accepted that, so she will join us in our April meeting as our 7th trustee. So I feel very good about that. We will be whole, and that's good, and that's good. And that's all I have tonight. And Ryan is filling in here for Jennifer Peschke. So do you want to go through your report?
All right, yes, ma'am. Thank you for having me while Ms. Peschke is on vacation. Quick report, we have responded to all questions from trustees as they have arisen and done some research for you all on various matters. We're continuing to review the annual deadlines and deliverables due to the district under the lease with IRCC and have responded to any questions that have arisen. As many of you are aware, there are currently some bills that do relate to hospital districts that are in the legislative session. So we have been monitoring those closely and will bring forth any information as necessary. We did complete the right-of-way transaction with the county, and Ms. Peschke is working with Cleveland Clinic's council and the VNA's council to amend existing agreements with the district and the hospital entered into in 2018. And then we have confirmed all trustee bonds that were up for renewal, so everyone should have confirmation of that in their files. We're in the process of canceling Ms. Zidan's bond, and we will now have to get a bond for Ms. Bartlett as she has been appointed. So that is our report.
Any questions, comments? Hearing none, we will go through with the financial review. Mr. Jones?
Well, as we remain in sound financial condition, as I think your data shows, we have about $13.5 million in bank and cash investments that are guaranteed by the federal government. We got about $8 million in remaining budgeted expenses. So based on that, we have about a $5 million reserve package that would be available for emergencies, which seem to pop up from time to time in this era of COVID. We have about $1.1 million, a little over that, $1.4 million left in tax revenues anticipated to be received between now and the end of the fiscal year, and we just spent about $1.1 million. So that leaves us still in very good financial shape.
That's good.
That's it.
Thank you. We like that, and things do come up, right, that are important. Executive Director Anne Marie Soriano.
Okay, boy, that was fast coming to me. You guys are so quick. Yesterday, I did talk about the bill that we are all currently in the midst of encouraging our legislators to, I guess, opposing our legislators to pass. There are a couple of others, as Ryan pointed out, and I would bring to your attention. They're not as significant as the one I talked about yesterday, but there are 3 others that have to do with legal notices, public meetings during a crisis like we had with the pandemic, and allowing for us not to have a quorum present in the room. And then there is a sovereign immunity out there too. So we're looking at those and watching those, and I'll let you know if those, go through or gain. Most of them do not have a partner in either the House or the Senate, whoever brought those, so they have to have a partnering bill in order to make it to law anyway. So we will keep an eye on those. The only other thing is, in my report, I talked about the memorial to Alma Lee Loy that we have been building and working on over this last year with the hospital. We are going to have a dedication for that, but in today's world, we're still not able to have a large gathering for that dedication of that. So the plan is to do that on April 10th, which will be the 1-year anniversary of her death. And we felt that was a fitting day. We have invited her niece and her goddaughter, I guess, to join us so they could accept that. It would be a small in-person, but it will be publicized on either Facebook Live or some media for everybody to attend and watch that, like what was happening with the ELC and others that have done some dedications to her, so that you can all see it in that way. But you can at any time drive by the hospital in the front and after that and see the garden and spend time in that garden. You'll see that it's very fitting to her, so we look forward to doing that. And I think that's it, unless there are questions on the other things I have been working on.
Okay, moving right along. Andrea Berry from Healthy Start, welcome.
Hello. I do have a presentation, but before, so while Kate gets that together, I will. I wanted to start. It's my pleasure to present A Mother's Plea, our first. Thank you, Kate. Fetal and infant mortality review for our community. But as we did this work, it gave us a chance to reflect, and so I want to start before we get into some of this heavier material with some gratitude towards this body. When we look back through the trends that have happened in infant mortality, we see the hospital district really coming to the rescue of our families, first by the creation of the Partners Group, then by acknowledging that the social determinants and behaviors influence outcomes and adding Healthy Start to that group, and then by funding this FEMA report, which typically is for bigger communities, but guess what? Small communities deserve to know what's going on with their infants as well. And by bringing a quality hospital company like Cleveland Clinic here, which has brought finally an MFM to our area, maternal fetal medicine, which is something that we've been looking to do since I've been here for 5 years, and I don't know how long before that it was lacking. On a personal note, I had a chance to meet Dr. Chapa, and he is amazing and such a gift to our community. So thank you to you all for making those things happen. So with that, A Mother's Plea is the title, and every time we met for this work, we would start with a moment of silence. So I'd like to draw your attention to this box, which is set up here, and this is the box that every family gets when they leave the hospital without their babies. So although we're talking about some, systemic changes and numbers and data, every one of these is a baby and a mother and a family that is affected forever. And so I want our focus to be there as we move into this work. So I'd like a few moments of silence. Thank you. Thank you. Okay, so can you go to I have the thing. Sorry, I forgot I had the thing. I can do it. How do I do it? Like that? Okay. Okay, so the first part of this is the process of FEMUR, which is essentially a community-led process, in this case led by Healthy Start, funded for the generosity of the hospital district. It was a 2-year process. This first one was a 2-year process, which we did not understand that when we started this process. We were brand new to FEMUR. We didn't know what a heavy lift it would really be. We had 26 agencies throughout Indian River County that attended these meetings monthly, and I have to say we hired a contractor to kind of guide us a little bit. And every time they're from down south, Palm Beach and Miami-Dade area, every time they came to these meetings, they were so overwhelmed with the amount of people in the room and how much our community really cares about the families of this community. So it just spoke volumes that this group was so dedicated. And even through the pandemic, when we shipped everything and had to start meeting via Zoom, we kept the process going and were able to complete. We reviewed 18 of 36 deaths that happened between 2014 and 2018. We chose those 18 due to the most robust files, so we tried to get as much information as we can. So medical records, autopsy reports, any Department of Children and Families, any Sheriff's Department records, anything that we can get, social services, and so we could get the best picture of these families, but also we wanted demographics that mirrored the births and the deaths that happened during this time frame. For our area, 12 to 20 cases is a fine number, and we did 18, so that's really good. As you see the little wheel, data gathering is the first step, case review, community action, changes in the community, and then data gathering. So we've gone through stage 1, stage 2, stage 3. We're in the process of changing, and we're already data collecting for 19 and 20. Okay. So I like to always give a little picture of maternal child health in our area, and most of you guys know a lot of this stuff, but for those of you at home, we always hover right around 1,200 births. For the very first time in a very long time, into 2020, we fell below 1,200, only by 7 births, but it's still interesting, and as we move into our fetal infant mortality, we will be doing more work finding out why that's the case. We did see an uptick in fetal death, unfortunately. We don't know if that's related. We did see the 2 months that were lowest were actually January and February in birth. So we don't know if that's related, but we'll do the work and we're going to find that out. So I like to present interesting information. But this is the best part, right? Which is success. So our infant and fetal death rates are very low. So in 2011, after the financial crisis in 2008, 2009, we saw the highest rate in infant mortality that we have ever seen in our county, ever, 2011. Since that time, we have worked very hard to lower that rate. In 2018, we took that photo of you all celebrating the lowest infant mortality that we've ever seen in the history of our county. And how did that happen? Well, hospital district plus Healthy Start, Cleveland Clinic makes a great team. These are all the programs that were added since 2011 at Healthy Start. So we added coordinated intake and referral. You guys refer to that also as maternity navigation, Babies and Beyond. That's the nurse home visit, the lactation in the hospital, the classes, community doula, nurse-family partnership, and parents as teachers all have been added since that time. So that work didn't just happen. That rate didn't just come down. It's because we gave it a lot of work, and we all invested in making sure our families were prioritized. So this slide I really like because this is a slide from 2011 and 2018. The counties that are the darkest are the counties with the worst, the highest rates of infant mortality. And as you see, we are looking pretty bad in 2011, and then in 2018, we're one of the lowest rates. But what I love about this slide is look at the other counties. Not a lot of counties changed, but it's because of the work we did that we made a difference and changed. So let's get to the data. What do we find in this fetal infant mortality review? Well, the medical causations do not really change that much from local and state and national. So we have congenital abnormalities, premature low birth weight, respiratory distress, infection, sepsis, and suffocation or sleep-related deaths. But what's more highly localized is the things that we found that were a little bit more, because of this area, right? More localized. The first being maternal age. So we look at birth primarily in age, happens kind of in a bell curve, right? And when we looked at the numbers for our fetal infant mortality review, what we found was that 28% of the cases we reviewed were advanced maternal age, that's above age 35, which tends to have a risk for higher poor birth outcomes. On the other end of that, we have teen births. And we added this because our area has a very high rate of teen birth, and we continue to combat that and try to find out what is going on with that. So on one end, you have a more likelihood for poor birth outcomes, and on the other end, the teen end, you have a more likelihood of having those social determinants that affect your life throughout your life, right? So that's the maternal age. The cesarean birth, I know that you guys have heard a lot about this. We have a 36% rate in 2019 countywide. That's not hospital-wide, that's countywide, 36%. We all know that's way too high, and we're all working on it, but it's worth mentioning that we need to bring it down, and we're all working really hard to do that. Preconception health. So this one is very interesting. It almost got brought up in every single case that we looked at. So 78% of the cases we reviewed reported that their pregnancy was unplanned or mistimed. However, only half of those were using birth control, and only 4 of those ladies reported that they received preconception care prior to pregnancy. And 3 of those ladies had endured a fetal or infant death prior to this loss. So preconception health is an area we need to look at. Being healthy before you move into your pregnancy, including family planning, including all of those things. Important stuff. The next one is social determinants of health is a little bit more wonky, and some people might not completely understand how this fits in, but I'm just gonna go to the next slide because I love it so much. This slide was a slide that was created through our fetal infant mortality review, and I feel like it really gives such a great picture to your health and why your health is important and what influences your health. So first, let's look at wealth disparities. So 78% of the women that we looked at were enrolled in Medicaid services. So typically we have about a 50% enrollment rate, so that's 18% higher than the county average for all births. 73% had a high school diploma or less, and 44% reported multiple stressors. So education, I went over that, okay. Geographic area. So geographic area is very interesting because oftentimes wealth and health kind of overlap a little bit, right? So we have, even if we take it down to the census tract, which I love, you probably might not be able to read it, but next to that 40% socioeconomic factors, it says 50% of your health can be traced back to your zip code. So we can even dive in a little bit deeper and say census tract. So if we look at the census tract of 50302, that's Gifford, it has one of the lowest per capita incomes in our county, has one of the highest infant mortality rates. And our highest per capita income, 50501, which is the island, has the lowest. So just kind of interesting, things like that. And of course, race and ethnicity. Black women represented only 17% of the moms that gave birth in the FEMA period, but 33% of the deaths. So we still have that issue of that. But another thing I love about this slide is that if you look at, we often try to put all of our eggs in the healthcare basket. Healthcare is all of our health. It's only 20% of your health. And why Healthy Start is so effective is because we hit on the socioeconomic factors, we hit on healthy behaviors, and we hit on the healthcare. That's why we can make such a big difference in the lives of women and families. So the next stage was the community action team. So we took all this information and we gave it to the community action team, and they made a list of the 3 things they thought were the most actionable: preconception health, awareness and education affecting moms and newborns, and enhanced care for women with high-risk pregnancies. So first is preconception health. So these are a lot of details that the group has prioritized. So the first is a Show Your Love campaign. This is a CDC and University of North Carolina program. It's free, open to the public, and we can use it for a social media campaign emphasizing the importance of preconception health. Second, preconception prep partners. We thought of this idea kind of like our doula program, getting people from the community to become educated about preconception health and spreading the word. Holding community-wide preconception health training. So that means for parents, for educators, for providers, anyone that wants to learn how to talk to your kids about sex, the importance of preconception health, all of that stuff. We're going to try to do trainings. And then to work with the school district to ensure that there's fidelity checks happening in their sex education classrooms. And that's a good step towards finding out if that is a problem. Awareness and education on issues affecting newborns and new moms. Of course, Healthy Start's already doing a lot of this, but we just launched a catalog of videos funded through the Community Foundation that is COVID-proof. It's on our website. Anyone could go on there any time of night, day, anytime, and find out about preconception health, find out about what drugs you should and should take during pregnancy, find out about all the things that you typically find out in our classes, but they're online, ready to go anytime, day or night. So that's the first step of that. The second one is the No One Told Me That campaign. A lot of those in our community action team really felt strongly that they moved into their pregnancy feeling like, no one told me all of this, and I wish someone had, and they thought that we could do a local No One Told Me That campaign. So we're going to work on that next. Lastly, enhanced care for high-risk pregnancies. So this one, it came up because twofold. Number one, the social determinants, but also because of lacking the maternal fetal medicine care. But Cleveland Clinic has taken care of that part for us. Thank you, Dr. Chapa, for coming down here 2 weeks a month and being separated from your family to help us. And so we concentrate on the social determinants, the Healthy Start part. So create more awareness around Healthy Start, the maternal opioid recovery effort. Carrie is here, and maybe you can talk a little bit about that with us too, but it's basically trying to help every mom, if you are substance misusing, to be the best mom you can be no matter what. We're gonna help you get there. And then sustain and expand Healthy Start programs being offered. And this one, I just wanna, looking at the data like I mentioned before, this is long-term stuff we really looked at throughout the years. And as we looked at, every time we have a downward economic trend, we have a uptick. And I'm cautious and a little bit scared about what's around the corner with infant mortality. Once the stimulus runs out, once people kind of forget what's going on, what's going to happen? And this is from a paper that has to do with the short-term and long-term implications on health after an economic crisis, increased poverty, poor nutrition, low investment in health and education, loss of social and family cohesion, and then long-term regression of developmental indicators, poverty traps, and reversal of progress attained by nonprofits. They refer to them as MGDs. And this is a nice one to end. I liked this slide because it's cute, but also because I was thinking about babies born a year ago today that are doing this right now have lived their whole life in the pandemic. Isn't that crazy to think about? It's just interesting to me, but mothers are more isolated than ever. Families don't know where to turn, and that's why Healthy Start is such an important part of our community right now. So thank you so much for your partnership, and I welcome any questions.
Of course, I have 1,000 questions.
Oh, good.
I have a few, so go
Okay,
ahead.
no, why don't you go ahead, because you know how I dominate. Go ahead.
I guess what I'm how much need is out there that you don't feel that you're covering? That's a tough question to,
Yeah.
know, but.
Well, right now, after once the pandemic started, we saw a huge increased need. And so a lot of our programs are at capacity right now. Nurse Family Partnership is one in particular that I would love to expand. It's so impactful, and the outcomes are tremendous, not just immediately, but generationally. We also saw a huge uptick in the acceptance rate for our nurse home visitor, which you guys also fund, which was great. But now that we're going back to being in person, one nurse can't do it. So we need a second nurse for that. And it really, if we were a corporation and we made money preventing infant mortality, we would be doubling down on staff right now and just adding everything we could to prevent what is possibly going to happen.
So do you think we're going to see an uptick in births because of the pandemic?
So there's conflicting evidence, like everything with the pandemic, but something said that there's going to be a downward tick. I anecdotally have seen an upward tick, and I've been watching the numbers monthly as they come in to see if there would be, and there's a slight uptick, but that could just be this time of the year, and then it will go down. So at the end of 2021, I think we'll have a really good picture of what's going on.
So I assume in this year's budget, you're going to be looking for some more support, right?
Yes.
That's coming up soon, isn't it?
That's coming up soon.
Yes,
it is.
yes.
Okay.
Yeah. Well, there are just a lot of questions. I know that in your statistics, you said that the barrier 32963 doesn't have as many, well,
But it's a rate.
there is a difference. A lot of it might be age-related.
Well, it's a rate, so the numbers truly are less, but the rate is per thousand, so that's kind of,
Right. And then the other thing is about the education going on, which I think is so key.
yes.
I'm sure, I know the school is doing as much as they can, and you're into Gifford Youth Achievement Center as well. So do you have enough? I know that you're at the Gifford Health
Center.
Clinic. So are you in the churches? Because education is so important, because a lot of our kids are having babies.
Yes, yes.
And that's where you get your problems with babies having babies.
Oh, yes. So typically, Healthy Starts do not do preconception health, believe it or not. So when we and the board wisely looked at this preconception health and said, yes, we will take it on, it is not typically done in the state of Florida. However, we've never really been one to follow the trends, so we're going to try it and see if we can make a difference. But no, there is not something going on right now with preconception health. In the schools, they are doing their best if they can, but we need to be doing more. Clearly, we need to be doing more. This in almost every single case that we looked at, preconception health was a contributing factor. So we need to start thinking about that.
Something that between TCCH and Whole Family and all that they can participate in as
Absolutely. I think we're starting the work to kind of bring people around the table to say, what can we do here? Is it going to be, pediatricians that when the kids are aging out and moving to do we have that conversation? Is it going to be, a teen program that we create? We really want to bring all the ideas around the table, because this is, this doesn't need to be led by Healthy Start. This can be led by anyone, but it's work that needs to be done for sure. And it needs to be unified throughout the community. So that's, it's a glaring weakness.
It's a major problem.
Yeah.
And are all these children having babies, actually, do they see pediatricians?
So, I would say that, so what's interesting and good is that we don't have a severely high rate of second-time teen moms. So in some counties, what we find is the first-time teen moms are high, but the second-time teen moms are even higher. But we don't have that because once they go to partners, they get linked up with Healthy Start unless they're resistant, but they typically are looking for someone to help them.
So the need is before the first one.
Correct. And we only get them once they're pregnant. It's too late then.
I think that needs to be an emphasis in some way, and if there's any way that any of us can volunteer to help you,
Ooh,
other
oh,
than
you're a
here.
nurse, so
you know?
you want to go talk to kids about pregnancy and sex education?
Yeah.
I would
used to
love
do
that.
Right, exactly.
Well,
I used to do that in the schools, yeah.
I'll invite you to the meetings that because we've been having them, which is how we prioritize those. I think a big step will be just to do those trainings because I think the more people that even know how to, I mean, I have 2 young boys. I want to know how to talk to my children about
Right.
sex, and I'm sure that it's not a comfortable subject for any parent to really take on unless you happen to be trained in that subject.
But I think the support that you're giving after is reinforcing your good, it's like another family for them. So it's getting them before.
Correct.
So maybe there's a concentration that
Yeah.
we need to work on
I agree.
in the community.
Anybody else have any?
Very good report.
Thank you.
Yeah, nice job, Andrea. I'd like to underscore that chart that Andrea showed with the graphs of the counties grayed out or darkened. And most counties didn't change, even though they had the same problem. And I would say there are 2 things that happened here. One is that as a group, we worked with the hospital and came up with patient outcome metrics, basically, and also patient satisfaction metrics. We worked together to really get focused on patient care. But in 2015, the other thing happened is that Healthy Start got embedded in the Partners in Women's Health program and began to meet these mothers as soon as they came in for prenatal care. And those 2 things, I think, have had a dramatic impact in our county's result. And now you have infant mortality in our county considerably below the state average. Unfortunately, it's not much better than Cuba. So we got work to do, but it's way better than the state average. And it just shows you that a unique program, working with these mothers. I love this concept, which I hadn't seen before. I wish somebody had told me that.
Yeah,
Yeah.
I like that too.
Yeah. Yeah, they like that too.
And I think that's really I was shocked when I first got involved with the Partners program, how uninformed, even ill-informed, misinformed, so many of these well-intended mothers were. So I compliment you on your work and thank you for the presentation.
Thank you.
And I think we're making a difference in improving the health in the community,
Yeah.
starting at the earliest age.
That's right. And thank you all. Thank you so much. I appreciate it.
Thank you.
Thank you for all the good work that you do, Andrea, and your team. It's really important.
I do. I have a great team. I really do.
You do.
Thank you so much.
Thank
guys.
you.
Thank you.
Good report.
Carrie from Substance Awareness. And now we want to keep them healthy, right, Carrie? Start them out good, and we want to keep them now.
I do want to acknowledge Andrea and her team because they really do a phenomenal job. I've had the opportunity to work closely with them, and the femur was definitely a heavy lift. And there's one thing that I say, sometimes the data is very despairing to me, but we really live in a community that cares, and it's so nice to sit around the table and be collaborative and moving from the problem into the solution. So that was a pleasure to work with you, and we are working on the MORE initiative together. And I love that we don't stay stuck in the problem and that we have people motivated to find a solution.
Same goes to you.
Thank you.
Actually, before you leave, I want to introduce Karen Campbell, who's the chairman of the Healthy Start Board. And so she's here too. And I'm not sure everybody here has met her.
No.
So,
Well, thank you. Thank you for what you do, too.
Right.
Yes.
Okay, Kate, what do I do? Do I just hit the arrow? Okay, I think most of you know who I am, but I will say my name. I'm Carrie Lester. I'm the Executive Director at the Substance Awareness Center, and I do have with me today our board of directors, vice chair, and our police chief, David Curry.
Hello, everybody.
And I brought our Kathy Jones. She is our certified recovery peer specialist. And I'm going to speak just a bit on the quantitative data. I like the qualitative data better, but I'm going to speak on the numbers a little bit. And I asked them to just come and share a little bit of the qualitative data with you from their perspective and their experiences with our program. So I'm just going to give you a snapshot, and it really truly is a snapshot of the work that we are doing at our agency. And I would love to come back and share with you other things that we're working on. But the funding that we receive addresses our peer, a lot of our peer and our recovery support services. And our peer outreach, what research and data tells us is that peers are very effective at engaging and retaining people into treatment services or a path of recovery. And so the bulk of the work that we had been doing was out at the jail. And of course, COVID changed all that. And I will say that we have not been out at the jail yet, but I did have a nice meeting with the sheriff maybe the beginning of February. And I've had 2 subsequent meetings out at the sheriff's office with his team. And so I'm very hopeful that we're moving towards a solution to bring it in. I've got commitment that they see the value and the importance of the work we do there. So. Hopefully we will be back there. But the other population, the jail's an important place for us to be. That's a very vulnerable population. But another population is our homeless population. It's very vulnerable to substance use disorders. And I will say that, Jeremy over at Camp Haven calls us a lot when there's issues with the guys, and I'll ask us questions and we figure out how to partner and support them. And so he had given me a phone call one day, and I said, you know what, maybe it would be a good idea for our peers to just come bring some of the programming they do out there. And so we had been working over at Camp Haven. And so during this report period, we were out there. We brought a lot of the work that we do over in the jail over to Camp Haven, and there were 10 men that participated in that. And then I talked to Tony over at The Source, and of course he's got a lot of irons in the fire, but he was very open and receptive, and he felt that really what we need to do is, he wanted to make sure his staff was on board. He said, my staff have to be on board first, so I want them trained. So we've gone out there, we've done 2 trainings with his staff, and I trained them on recovery-oriented system of care, really understanding what that means, the emphasis that puts on the role the community plays in a recovery-oriented system of care, and the emphasis that is placed on peers and what their role would be. And then we did a little education around substance use disorders, and we did some education on Narcan. We made sure they had Narcan kits on site there. And then just the general outreach engagement in this time span, Kathy single-handedly has touched 300 persons. Some of that might have just been a phone call, but others really are the active steps to bring somebody into treatment or help get them connected to another level of care or a treatment program or a community resource, because we truly believe there's no wrong door at our agency. And so Kathy has been very, very busy, and I want you to kind of hear her perspective on things. The other piece is medication-assisted treatment. And our peers have a role in this because there's still a lot of stigma around medication-assisted treatment in the community in general, but even in our recovery community. There's still a lot of belief, that we're just replacing one drug with another. And so for a peer to educate on FDA-approved medications, there's a little bit of power and value in that. And so we educated 147 people in this time period on medication-assisted treatment, the FDA-approved medications. 24 of those people actually sat across from one of our counselors to receive a screening and referral for the medication. And of those 24, 10 actually were qualified medically through the process and accessed medication-assisted treatment. And I have to really give my hats off to Treasure Coast Community Health. We would not have this available in our community without that partnership. We are the DCF licensed substance abuse treatment program in our community that can access the funds. They have the medical staff that can provide that side. So it's a great partnership, and Vicki's been wonderful and her team so that we can provide that. And what that means is anybody, regardless of ability to pay, has access to the highest quality treatment services available. And so that's really important. The medication that most are accessing is Vivitrol, and so that's a $1,500 medication a month, and so we can provide that to anybody who needs that. And then Narcan. We knew with the pandemic that the lockdowns were not going to be good for substance users, and so we really did ramp up our Narcan training and our Narcan training efforts. And so in that time period, we trained 152 people in overdose prevention. And of those people who were trained, 112 of them took kits home or out into our community. And we've had 20 known reversals reported to us. And I asked Chief Curry to come speak a little bit on the community side of things. You know, nationally, we broke a record we didn't want to break. In a 12-month period, we've had over 81,000 overdose deaths nationally. And I get the reports, we are breaking records on overdose calls in our community. I get them from the sheriff's office. Chief Curry and I talk a lot about it. And I thought maybe you could share just a little bit from your perspective, how you see it impacting our community and how our agency has been supporting that.
You want me to do that right now? Is that what you're saying? Good afternoon, everybody. My name is David Curry. I've been with the police department for going on 32 years. I was the assistant chief for 6, and now I've been the chief for almost 10 years. So certainly proud and pleased to be here and to represent the Vero Beach Police Department and the city of Vero Beach. So I just want to tell you that we've all been on boards and we've all been on committees, and I've been on this board since 2012, and there's a reason. It's the experience and the compassion, the dedication that Carrie and her team has there at the Substance Awareness Center, and the people that they touch and reach through our community. So with our Narcan, as you may know, law enforcement for the most part, we get grant-funded Narcan. So it's fortunate because those doses can be around $75 a dose. So we've been fortunate since the opioid epidemic to get pretty much not pay for one single dose of Narcan. But so 2019, we saw in our city limits, and these are just our city limits, we had approximately 26 overdoses, and 6 or 7 were fatal. In 2020, we doubled that to 52-ish, and about the same amount of fatalities, deaths. So not that that's a bright side, but we didn't increase our fatalities, deaths, with the number of overdoses. So that was a good thing in that regard. And we've made a number of deployments. I think of those 52 deaths, we deployed Narcan like 31 times. So we certainly reverse and save lives almost daily in the city of Vero Beach. So there's just some numbers the last couple of years. So far this year, we hope to see this trend. We've had 7 overdose since the first of the year and 1 fatality, and that's a little less than last year this time, so hopefully that'll continue, but certainly we're not so sure of that.
And I know Chief was sharing with me after a meeting, you know, he had shared that they were working a case on an overdose death, and you shared that you just looked at that Facebook page and you had shared with me a little bit about, you know, that person, you could tell that they were struggling and they were trying. And what it struck me was all of those, you know, we see the data, we see the numbers, but like Andrea said, there's a person behind that. And when you shared that Facebook piece with me, it's like, you know, these are people and people who are struggling and trying, and people who have had recovery, and some people who won't wake up the next day. And
It was a 40-something female, and she had been arrested, unfortunately, about 6 times, and most of it was drug-related. And she was our last fatality. We weren't able to help her. Unfortunately, we weren't able to get to her in time. But as Carrie mentioned, you know, I certainly wonder, and so I just went on Facebook because I know we had dealt with her before, and you see the Facebook page, you see that she probably has a couple young children. I don't believe they were with her when she passed, but you put a face to it, and she had a hard road. It sounded like her comments to on Facebook and friends as far as her battles and tribulations over the period of time, trying to get better and trying to be a better person, and it wasn't meant to be, unfortunately, for her. So we see that all too often.
Can I ask a question? You're dealing with the people who are users and trying to get them off. And I guess maybe this is for you, Chief, but what are we doing, and how are we doing anything about the ones who are dealing the drugs?
Well, in 19, we honestly think the numbers decreased because of an arrest we made. We had a major, certainly this individual, we can't be naive to think he was the only person dealing in opioids and heroin, but he was a major person dealing in our city. And we made an arrest, and it was literally for a few months, it plummeted, the numbers just stopped. So we hope and think that we attribute it to that. In 20, although our numbers increased, we had an individual that literally, and this is a story too, and I don't want to take up too much time, but I remember this individual when he was about 5 or 6 going to his parents' house for domestic violence and seeing him and his little sister there and watching mom and dad fight and throw things. And this same 6-year-old grew up to be a 30-something and was dealing drugs, getting his drugs in Orlando, bringing them here. And we first stopped him. He was asleep at the wheel at 16th Street in Old Dixie and had a firearm in his waistband, passed out from opioids himself, the user, and had quite a bit on him then. We stopped him a few months later and probably made the biggest opioid drug bust that the city has ever made, and seized like 100 packets of heroin from his vehicle, $50-some thousand that we seized. We took a lot of drugs off the street. We took, of course, him off the street, and he's going to do a lot of time, but he was an addict himself. So yes, we certainly are combating that as far as the dealers and things like that, working with, people that have used and are helping us from a confidential standpoint, and that as far as a resource and that kind of thing, and collaborating with the other agencies in the county as well, because the drug dealers don't play boundaries. They'll deal in the county or the city or go to Sebastian, wherever the money takes them. So,
Chief Curry, I have a question. The age group, I know that you're aware of the collaborative that's going on right now to address our children with this problem and really try to get them before it becomes the problem. Is there an age group with the overdoses and the deaths? Is there an age group that is predominant, and what is that? If you can share?
That's a good question, and I keep that data too, again, specifically with the city, but I think it's pretty much anywhere. It's actually older. It's older. It's in your 30s to early 40s.
Exactly.
Predominantly white, male, female, of course. But it's, a lot of it with the opioids, unfortunately, we can go back to the early 90s. In the 90s, some of us may remember the overprescription. And we read about pharma and some of the lawsuits that people were being overprescribed. They had car crashes, they had surgeries, and they were being overprescribed and unfortunately became addicted. So a lot of those people are the ones that are addicted that we're dealing with now and that are sick and are, passing away in some cases. So it's actually, from the opioid overdose standpoint, it's actually an older age, in that 30s, probably mid-30s to early 40s on an average, from us anyway.
Thank you.
Yes, ma'am.
The other, and I'll keep going, the other piece on that, thank you, and I think about the firsthand side, you can't help but take some of it personally too, and I think about our first responders who go on multiple calls, or your team who's working these cases and what the toll that takes and is in our community. I know I received the emails from the sheriff's office, and there was one day I emailed Stephanie back, and because she sends them almost in real time, and I just said, please stop, not another. And, there must have been, a bad batch or something out, but, it's like my heart gets heavy every time I see those. And so, again, we have a community that wants to move from the problem into the solution, and so, I will be working with all of our law enforcement agencies and first responders to figure out what can we do better by substance abusers in our community. One thing we can do is we have a recovery assistance program. And so we served 9 residents in our recovery assistance program in this time period. And we were able to celebrate 4 successful completions. We had one that was unsuccessful. And then the other piece of funding we received from you helps us with the assessments that we need to do coming into our program. And so we conducted 78 adult assessments, and these are level of care assessments, and we use the ASAM continuum or co-triage to do those level of care assessments. And then we did 37 adolescent assessments. On the adult side, we're doing level of care. On the adolescent side, it's a prevention assessment tool. So we're doing a risk needs assessment. Is this a low risk, low need kid or a higher risk, high need youth? But we are also looking, is there a substance use disorder? Because if there is, we want to make sure we access treatment. It's no longer going to fit in prevention. So we were able to do that. Some of the outcome measures, abstinence. So actually in our recovery assistance program, we had 100% of our people, we didn't have any relapses in our recovery assistance program during this time period. So 100% maintained their abstinence. And then recovery capital. Now, this data point is a little wonky on us this time, and I'll explain why. We had the opportunity to move from a paper recovery capital scale to an electronic version, which is recovery capital index. So they both measure recovery capital, but they score them differently. And so I had two different data points on this. For the residents that we measured recovery capital on the scale, on the scale, we saw a 10-point increase. And for the ones that we measured on the electronic index, we had a 54-point increase. And so the recovery capital scale maxes out at 175 points, and the index goes to 300 points. And so the good news is we saw increase in recovery capital. That's the goal of the program, is to build that capital. Employment. 75%, 3 of the 4 successful completers were employed at discharge, but I will do a little footnote here. One of the clients that we transitioned successfully, he did really well. His substance use disorder was stabilized, and we were able to transition him out successfully. However, his mental illness still had high acuity, and so what we really did was we sent him where he was going to still have higher level services, and just employment wasn't really appropriate at that time for him. And then for housing, 100% of the people successfully completing we did discharge them into stable, safe, stable housing, which is an important goal of ours. And then social support. A key to recovery is social connectedness, social support, which is why we're so concerned when COVID came. And 100% of our clients successfully completing had social connectedness. And I'm not going to read the testimonials. However, I do really encourage you to read them. And what I did is I asked Kathy to come today and to just share a little bit, because she's on the receiving end. She's on the phone with these people and texting, to just share really what the clients say and what the experience has been for her working. She's on the front end. I was touching 300 people, working with the clients coming in and out of our program.
Thank you, Carrie. Just to see those testimonials up there just brings me to tears again. And 300, I don't even know how I did 300, but that's a series of different things. But I can tell you what a joy and a privilege it is to reach out to these ladies, and how eager and excited they are to share where they are. And that I can't bring you the power of their voice. I wish I could. And every time every letter I got back as I reached out to them, I'm like, send in Carrie, and I'm like, and it's a joy for us to hear. But I see them in community too. Just as recent as yesterday, I was in a community meeting, and one of the women whose letters is in here shared, and I remember when I had the first conversation before they came, when I invited them into the program, and then they were willing to come. So I remember that voice, and then I see the beauty of and the transformation. And so I hope you take the time to read them. Their voices are powerful. I wish I could bring the voice to you.
Kathy's gone out to the jail on a lot of our clients, so she's screened them while they're in jail, gotten them transportation, the support systems we've built up in the recovery community. We've had people go to the jail, meet our clients, and then Kathy's able to give them a warm reception, at our program. And so it truly is phenomenal. I think for me, though, the real testimony is we're talking about people who've been out of our program for over a year. When I read some of those and I hear 4 years, 5 years, 3 years, 2 years.
Yeah, as many as 5, 6.
When I think about the impact when we change one person's life like that, when we break a cycle in a family, what that really truly means. And so, I'm looking at some of the names, and some have come back and they just have stuck their head in the office to say hello, and you won't believe I've got my kids with me, or I'm getting married, or I've got this new job.
And they're excited to give back as well.
I don't know what the rules are. I know people that are in recovery are very happy to share their experiences, and I know that we've heard that over and over again at certain organizations. I don't know if it would be appropriate if any one person felt that they would like to. They don't have to share their name, just their experience. Some people really would like to share that, and I don't know, if it would be appropriate. So, but they would have to want to do that, because I know that once they're in recovery, they really would like to share it with others and their experience.
We encourage
them to do that, and they would be, they offer to, and that would not be new to them.
Yeah, right.
To bring their to share.
And for some of them too, I think one of them had shared she was actually going through a training course in addiction studies. But there are, like Kathy's a certified peer. They can go. We encourage them. There's a training they can go through, a 40-hour training where they can learn how to use their lived experience and give back
Right,
in multiple
exactly.
ways.
Which is what,
It's so invaluable. It
yes,
just truly
absolutely.
is a
You can
connection
help
that can be
somebody else, right.
The other thing I can share is I just nailed down today with the source. We'll be going there once a week.
That's great.
Good,
We'll be
wonderful.
doing Narcan training there once a month, and the other 3 weeks of the month, Tony and I will be in there.
Great,
That's
So
wonderful.
we've got that.
congratulations.
roll out.
You're doing great work.
Thank you.
Busy. Thank you for your support and your time. Do you have any other questions for me?
Any other questions? No, just such an important thing, and thank you for being part of helping all of these people.
Well, thank you for recognizing that. The problem is significant, but there is a solution, and recovery does work. So thank you.
Keep it up.
Thank you.
Oh, we had another known reversal reported to us today.
Okay, that's great.
Yes.
Okay.
Okay?
All right,
Thank you.
Appreciate it. Any unfinished business from trustees? Okay, we do have new business. We've got David Gibbs from Phoenix Rising.
Good afternoon. I am David Gibbs. I am the clinical director of Phoenix Rising Wellness Center. And as you have in your packet, I'm here today on behalf of our CEO, Pedro, to request additional funding. Before I continue, though, I want to introduce two people that came to this experience with me, because this is the first time I've been here. I have Misty and Mike, who are both, Misty works in our intake and outreach, and Mike does the case management. And I'll tap into all of the things that both of them do in some of the discussion. And I know we're a little bit on time, so I'm just going to get right to the point. First, as everyone has said, thank you for all that you have done with the funding for Phoenix Rising Wellness as of October 1st, 2020. And I guess the really wonderful thing about it is that the community has been made aware of it, and that is what brings me here today to ask for additional funding. Just to give you some numbers, at this point, up to this point, we have served 26 clients, both in PHP and IOP, which equals to 489 treatment days. Additionally, Phoenix Rising has provided 14 clients scholarships, which totaled to 103 days of treatment services. One of the things that I really am excited about, real honestly, is about the fact that I'm here to be able to tell you, I met Pedro probably about now 6 years ago. He was a mental health tech at another treatment center that I was a therapist. And one of his passions was really evident about wanting to help the clients that were coming into treatment differently than the treatment center that we were working in. And initially, I helped Pedro start Phoenix Rising, and then I moved on to something else a little different, and then came back because, again, Pedro's commitment to his word to helping those individuals in recovery in a different way. And this is where I would just take time to highlight what we have done that I really believe separates us in the process of helping those individuals in the community who suffer from addiction. I pointed out Mike, and why I will bring him up as it relates to the work that he does is as yesterday, the latest, earliest point of memory is he took the entire PHP and IOP client to United Against Poverty. So what we're actively doing is we are reaching our hand out and we are educating the clients that are coming to our services about the services available to them beyond the scope of Phoenix Rising Wellness Center. Success happens that way. we have to be able to educate and train these individuals on a number of things. The first thing is the disease of addiction. Secondly, as part of that, getting into the neural pathways of the brain. I'm a big neural pathway guy. Wrote a book called Humbug to Happiness, Breaking the Chains of the Past. The focus of it is how every human being imprints messages throughout their life, and you witnessed it today through the presenters today, that it is a familia process, right? It is a family system process. So the police officer, the sheriff has said, or chief had said, that he remembered going into a home where a 3 and 4-year-old child that he saw later in life was an addict. So what we have to recognize is in that developmental process, there are individuals who are absorbing incorrect messages that are creating the destructive patterns of their life. And what we continue to do, those individuals continue to do, is regurgitate that destructive pattern. They bring children into the world, and that destructive pattern then is passed on. So part of the most significant piece of this process is we have to help them understand how their brain works, and that's what we do clinically. So we're spending time helping them understand exactly how they got where they are. And then more importantly, the most important piece is, again, reaching our hands out to the community and getting them to educate and learn about what's available to them beyond Phoenix Rising Wellness. That's where the success will happen. Research shows that typically people relapse because they lack understanding of the services that are out there available to them. So if we actively, in vivo, in a life experience, drive them to the various community services available to them, they then can make that connection. And as they make that connection, again, we're working with the brain, right? We go back to the neural pathways. We are training them, right? Again, I don't know how many of you are familiar with Pavlov's dog experiment, right? The bell and the food, the bell and the food. Do they produce saliva or not? So in essence, that's really what we're doing, and it's not to sound crude, but the reality is we are all being trained that way. Unfortunately, the people we serve have been just trained the wrong way. And so it's all about retraining. And that's what brings enthusiasm to me about this work. I've been doing it for over 26 years. From Ohio, came to Florida, been here for about 20 years. And I do have to say this, it was mentioned earlier. I have always been impressed with this area's willingness to step up and look at solutions and the connection that is within the community. Different hands reaching out and being supportive. It's always impressed me, and I think it's one of the most significant things that this community has to offer to everyone who lives in the community. So today, again, what we know is that when a door opens and we are able to serve people, the word gets out. And we all have a passion. Misty is the director of our outreach, and she also does the intake. Even before she came here today, she was doing an intake. So, she sees the calls, hears the calls coming in, and we really want to serve these clients in the community. We have served a number of individuals, homeless individuals, and we do have a number of people on the waiting list. That was what's motivated Pedro to have me come in today and present to you all the request for additional funding. And that's really kind of sums it up, unless Mike or Misty would like to share some words. And I'm always impressed with Michael, and he comes in dressed to the nines every day. Best part is the socks always match.
Just briefly, I just want to talk about the continuum of care and how important. First off, we've heard many a times of the thank yous. And the umbrella, what I get to do as case management is be solutions waiting to happen. And what that looks like is that they could literally come off the street day one, 28 days later, and then finish up IOP. But then what's next? And that umbrella, that's TCCH, Mental Health Association, United Against Poverty. So literally, there's no excuse. They have everything put in place, thanks to this board. So I have the contacts that are made within 2 weeks. They have a TCCH appointment for their sliding scale. They have all the documents. They're sent over to Salvation Army, our not-for-profits that are doing amazing work in this community. I'm president of one that are able to help with the clothing, with the food. But within 2 weeks, we have a homeless declaration, Salvation signed off. We have a presence of treatment letter. They're able to go to TCCH and get it on their sliding scale. Their first medical appointment, they're able to go to dental. As soon as they leave us from IOP, they get to continue on with that outpatient care, whether that looks like Mental Health Association or TCCH Behavioral. So day one, I mean, there is that path to success. So I mainly just want you guys to see what a day at Phoenix Rising Wellness Center truly looks like. Yesterday could have been homeless, now talking to Misty, and now they're into the sober living community. And literally, they get that chance. So we're asking that we can be able to give more chances, and we want to thank the hospital district. Thank you.
Thanks, Mike. Thank you for that. Really important piece to the process. What research shows, the longer the individual stays involved with treatment, that connection will reach success to their longevity of their recovery. So we do have the continuum of care, PHP and IOP. And again, the impressive piece, again, working with Mike and Misty, is their commitment and their drive every day to make contact with any agency out there available to help the people that we serve and the people that you have blessed us with the ability to serve by your funding. So we truly appreciate it, and I do want to ask Misty if she has anything she'd like to add as outreach or intake.
So first, I wanted to thank you guys for the opportunity to help these people. I am in recovery myself. I'm actually alumni from Phoenix. I graduated in 2018. I have a little over 2.5 years sober. I've been to many treatment centers, and Phoenix Rising was the one that worked, not because, David was there to teach me what was going on in my mind, but Phoenix also helped me stay sober outside of treatment, right? They gave me the life skills that I was lacking, even after being in treatment for a long time. But I also wanted to say, I was the one that Phoenix scholarshiped. I didn't have insurance. I did not have money. My family wrote me off a long time ago. And if it wasn't for Phoenix giving me a shot, I don't know if I would even be alive today. And you guys have given the opportunity I have to several men and women, and I wanted to say how much I appreciate that on a personal level. Also, since I'm alumni, I also reach out to all of our alumni, whether they were with us for 2 days and didn't complete, or if they did complete. We have a lot of success stories, and I can't wait to see if we do have the ability to continue working with the homeless and the indigent, what their success stories are going to look like in a year. I have men and women that are working, I have men and women that are married, I have men and women that have gotten their kids back, me being one of them. There's a lot of us out there in your community that got a chance at Phoenix to learn how to live. And I'm just super grateful. Thank you.
Congratulations.
Yeah,
Thank you.
I'll give her a hug. I don't care what you guys think. Because she is actually amazing. I'm actually choked up myself with her story. But, and I'm glad that she felt comfortable to do that. Because that's what this is really all about, right? That really is what it's about. And she has reached a point where now she's truly giving back in a magnificent way, to be able to share her story and to be able to talk to people who are really struggling, making a commitment for treatment. So I just think that's a great way to end it, and we really hope that you see the work that we've been doing as very positive, and you have a strong willingness to continue to fund.
So I have a couple questions,
Sure.
just for clarity's sake. First of all, generally, where do your clients come from?
Wow, that's a good question, and probably Misty would be the best to answer that because she does all this.
So,
Numbers.
as far as hospital district goes, that would be New Horizons, Mental Health Association, word of mouth.
Okay.
A lot of word of mouth.
And they come and live there?
I'm sorry?
When they come in, as Mike indicated, part of our process is they have the option, we do sober living, and they can also live in the community, and we provide transportation and assistance. We encourage the sober living environment simply because, again, if birds of a feather flock together, let's go to something that my parents used to tell us as kids growing up, and I'm like, what are you saying? But now I understand, right? So, so we encourage the sober living, but there are those individuals who live, in their residence in the community, and we will provide transportation, or they transport themselves to the facility.
And it's a 28-day program?
PHP is 28, 30 days, and then they step into IOP, intensive outpatient,
Okay.
which is an 8-week program.
Do you have a detox portion of your treatment?
We don't have a detox portion of it. We actually have relationships with detox in the different communities surrounding us.
But not in Vero Beach?
None in Vero Beach.
No, there's none in Vero Beach.
We do
No
have,
detox.
been working on a residential treatment center.
And you talked a lot about the homeless and people like that, I understand, but there are a lot of people out there that have this problem that are not necessarily homeless. But where does your funding come from, if not from the district?
Well, we are for profit, so we do insurance, we do self-pay, so we have a mixed payer source.
Okay. And the biggest question I think I had of Pedro was, is there any chance that you will be doing a foundation or a 501c3 to raise money? Yes, here we go. Okay, good.
Intending on doing that, and
Yes.
begun the process.
Do you have a board that will be helping you do that?
Yes, the answer is yes. So Pedro formed a foundation. It's in the process of being dissolved. I'm the president of Team Success. Pedro's the vice president. We are looking into that right now. We have an ambulance that's going to be going out into the woods to help with the homeless community. But we are looking into that. We're also exploring the detox as well.
But I'm talking about the 501c3.
Yes, we haven't established, and it's the harm reduction program of it is already as of last month.
So you have your 501c3 accredited,
Team
right?
Success Enterprise.
Okay, and you do have a board with a
Yep.
chairman and all that?
Yes, ma'am.
Okay, good.
501c3. So you're looking for $200,000 to serve another 20 to
20 to
20?
28 additional clients.
And what time frame is that for the remaining of our fiscal year? Of our fiscal year. All right.
Now, do you already have these clients, it's like on the waiting list, or?
We do have a waiting list.
And these are only hospital district qualified, is what you're talking? Okay. All right.
What did they say, 10? Wasn't there 10 or 15 on your waiting list that you've already
Four-
qualified?
14 at the time, yes.
14
Okay.
you've already qualified.
You don't anticipate any problem getting to 28 then?
No, absolutely not.
Yeah, that's too bad, but yeah.
So,
We'd love to be able to have a different story, right? I mean, you're absolutely right. Unfortunately, it's out.
It is what it is.
so can I hear a motion?
So move.
I
A
second.
second. Any other comment from trustees? Okay, then we'll take a vote. Barbara? Yes. Anne Marie?
And yes,
Yes.
Ellen? Michael?
Yes.
And I say yes, so we will give you your $200,000.
however, I would like to say that coming forward, I love these reports on success and what you're doing and how you're advancing, because the need is so great, and we have sadly needed this in the community for quite a while since Hanley Origins left, to be perfectly honest. But it's good to see your chairman of the board and to know what you're doing in the fundraising piece and all the, I'm a big fundraiser, so and I'm,
Gonna help you. if you're-
yeah. So, no, it's just that I think it's important not to just rely on the district for funding for everything. And, to go out there, there are a lot of people that don't qualify but still need the help and don't have the insurance or the money, but they don't qualify. They're out there. That's sort of that group that you can fundraise for.
Do you accept any age group?
18, have to be adult. So 18.
Okay, 18 and above. Okay, and anywhere above?
CCF license.
Anywhere above?
Anywhere above, yeah.
Okay, all right.
And what the chief had shared, it is more prevalent today that it's the baby boomer who is the addict and struggling with addiction. So just simply by the way things have happened in our culture, so.
Yeah.
But I really
Good luck
truly
with it
appreciate
all.
your time.
Well, thank
all
you
of
very much. Thank you very much.
And congratulations. Just keep up the good work.
luck. Good luck.
One day at a time.
Exactly right. Exactly right. Okay, any other business from trustees? Any public comment? There's no public here.
Yeah.
Yeah.
Any comment, Myra?
All right, we are adjourned then. Thank you all.